Going back 2 years ago, we had several number of vacancies for registered nurses in the Trust, with no ready supply coming from within the UK. So I asked Health Education England to help us with that immediate problem that we had. They listened and contacted me to say would I be willing to participate in the Global Health Exchange programme, and asked me to travel to India with them to start to negotiate such a programme.
For me personally, I was very attracted to the model of earn, learn and return, because we felt that colleagues who came to join us would bring some skills with them, they would add value to the organisation, and then they would be able to return to their home countries taking a new set of skills back.
Patients get high quality, compassionate caring. We get vacancies filled that we have within our hospitals and in our community placements at the moment, which means that the care can be timely, it can be compassionate, it can be caring, and that we can also increase the number of patients that we're able to treat.
I teach all the international nurses for train them for OSCE training, and I help them all other when they came to this country. I'm just helping them for continuous progression actually. I gone through the same process, so I know how it is, and I'm here to help them, not only teaching side, from other side also, so I am here to help them.
A lot of people came and told you should go to this place or this place, but I choose to go to Harrogate, and now I think that was the best decision that I made in my life, because it's a very good place and a lot of good people, and the hospital which I work is also very good. I get a lot of support.
It's a quiet town. I've always liked to live in a quiet place because where I come from is a bustling city, always busy. So I like Harrogate because it's quiet, it's peaceful.
They have arranged everything for us before we arrived, and so it was very easy for me to get settled here.
I like the place very much because it's a very peaceful area and we have nice people around us. It's very good time for us, me, myself and my family. We are really enjoying it here.
Right now, I'm getting lots of support from my ward managers, my colleagues at work, and in fact the entire staff of the hospital and every person I've met in the town and in the church, in the community. I really feel special and welcomed. Thank you very much.
Very nice and decent people here. We have a very good people to communicate with, very good people to interact with. They all treat us very good. So I think Harrogate is, we think it's the most happiest place. Yeah.
The hospital, they arranged the accommodation before we came in, and it's a 2-bedroom flat, and they paid the rent for 3 months, and they are also providing many helpful things like arranging a direct debit from my salary, and they also had a word with the landlord if we can stay in there for a longer time. And even if in the case of a deposits or it was fully furnished by the hospital when we came in, so we were like completely settled in the very first day itself.
We thought only the house would be arranged, but when we came in, almost all the furniture was there, and we got all the utensils.
I live in a 2-bedroom apartment or flat. It's a nice, quiet place and it's very close to town. I like the fact that I have easy access to the supermarket just behind my house, and anytime I want to go to Marks and Spencer's or Primark in town, it's just 4 minutes walk. That's really fantastic. So because being in a new town, you really don't know exactly the things you need throughout the week. So living close to the town center is very, very handy for me. So it's really a nice place. It's well managed. If there's any faults, if you just call the managers and they just come in immediately that same day and sort it out. Very nice, very nice.
So there are 2 entry requirements to get onto the nursing and midwifery register. One is a computer-based test in the country, and secondly is to undertake the OSCE examinations in the UK. And in addition to that, there's international English language testing system score to be achieved. So our nurses have been through that process to become registered, and they're on the register for the NMC in the UK, which is one of the best registers to be on in terms of practicing nursing, and it's eminently transferable to other places. So a lot of hard work and effort to get there, but once you get there, then you'll get the benefits and reap the rewards from that.
At present, I'm working in the surgical ward, and now I'm on my supernumerary period. As soon as I got my PIN registration number, and they are very much taking care of me. They are supporting me a lot. They're teaching me how we do in wards. They are entirely different from India, so they are teaching me how we can manage the patients in here, how we can handle them, how we can manage the relatives, and it's a very nice experience. I'm on my way to be independent in my ward.
I'm learning a lot of things in my profession. I'm learning key professionalism as regarding documentation in nursing, which I have never in my life seen before. The importance of accurate, precise documentation, which is very, very exciting for me.
In India, we have a very different culture. I think we give more respect and dignity to the patients here than as compared to India.
We are getting a lot of opportunities to learn from here. So definitely I think I would be a better nurse when I go from here.
We have got a lot of support from the hospital in learning and studying as part of OSCE also. We had got a good teacher, so she supported us a lot. And even though where the ward I'm working, the staff there are also helping me to learn each and everything in the ward.
Have more opportunities here. This place gives us more opportunity to develop ourselves.
It's a great privilege for me to be able to visit this trust today because I wanted to see at first hand the work that's gone on with the first cohorts of students that have come into this country on our Earn, Learn and Return programme.
I think you could see today by Professor Ian Cummings' visit to us, I'm really proud that we've got our 5 first learners here. You can see the benefits that that's bringing to this organisation in terms of the diversity in supporting our patients.
Yeah, I think it's a good thing. It's a very good thing. It's just that whoever would come should be properly prepared, properly informed in details as regards what to expect, both in the learning process and in the cost effect.
It was really hard for us to cope up with the climate here, but it's fun. Playing with the snow, and when we came here, that was really nice.
The HE, they explained their benefits, their advantages, what they can provide me, and it was every word were kept, like the visa fees, even if in the case of visa fees, the flight ticket, everything was accurate.
Yes, of course, it's a good thing when we think about the lifestyle and the living standard as compared to India. We can have more opportunities here. This place gives us more opportunity to develop ourselves, to go into, if we want to study further, if we have to do anything, we have to, for us to grow, they give more opportunities here.
Everybody is so nice, so supportive. I really appreciate that.
They've settled in really well. There's been a lot of work that we've put into the programme through clinical practice facilitators. So almost from day one, when people arrived in the UK, they were supported on their educational pathway to get them to the point of being able to qualify with their OSCE training so that they could become registered nurses as quickly as possible. But then there's other practical things about accommodation, housing, bank accounts, all the small things that we take for granted of living and working in the United Kingdom. We had to make sure that the Indian nurses and others were given that knowledge, that information in a timely way.